You said while the law was being debated, if you like your plan, you can keep it. You said after the law was implemented or signed, if you like your plan, you can keep it. Americans believed you, sir, when you said that to them over and over. Do you not believe, sir, the American people deserve a deeper, more transparent accountability from you as to why you said that over and over when your own statistics published in the Federal Register alerted your policy staff, and I presume you, the fact that millions of Americans would, in fact, probably fall into the very gap you're trying to administratively fix now? That's one question. Second question. You were informed, or several people in this building were informed, 2 weeks before the launch of the website that it was failing the most basic tests internally. And yet a decision was made to launch the website on October 1st. Did you, sir, make that test? And if so, did you regret that?
Okay, on the website, I was not informed directly that the website would not be working as the way it was supposed to. Had I been informed, I wouldn't be going out saying, boy, this is going to be great. You know, I'm accused of a lot of things, but I don't think I'm stupid enough to go around saying this is going to be like shopping on Amazon or Travelocity a week before the website opens if I thought that it wasn't going to work. So clearly, we and I did not have enough awareness about the problems in the website. Even a week into it, the thinking was that these were some glitches that would be fixed with patches, as opposed to some broader systemic problems that took much longer to fix, and we're still working on them. So you know, that doesn't excuse the fact that they just don't work. But I think it's fair to say that no, Garrett Major, we would not have rolled out something knowing very well that it wasn't going to work the way it was supposed to, given all the scrutiny that we knew was going to be on the website. With respect to the pledge I made that if you like your plan, you can keep it. I think, you know, and I've said in interviews that there is no doubt that the way I put that forward unequivocally ended up not being accurate. It was not because of my intention not to deliver on that commitment and that promise. We put a grandfather clause into the law, but it was insufficient. Keep in mind that the individual market accounts for 5% of the population. So when I said you can keep your health care, you know, I'm looking at folks who've got employer-based health care, I'm looking at folks who've got Medicare and Medicaid, and that accounts for the vast majority of Americans. And then for people who don't have any health insurance at all, obviously that didn't apply. My commitment to them was you're going to be able to get affordable health care for the first time. You have an individual market that accounts for about 5% of the population, and our working assumption was, my working assumption was, that the majority of those folks would find better policies at lower costs or the same costs in the marketplaces, and that the universe of folks who potentially would not find a better deal in the marketplaces, the grandfather clause would work sufficiently for them. And it didn't. And again, that's on us.